Hi, I'm Audra Burns from Dartmouth-Hitchcock. We're celebrating a milestone here at Dartmouth-Hitchcock Medical Center. Our solid organ transplant program recently completed their 1,000th transplant. In this video, you'll meet two members from our transplant team, as well as a representative from New England Donor Services. I'm joined now with Section Chief of Solid Organ Transplant, Dr. Michael Daly, to talk about this news and to learn more about the program. Dr. Daly, let's talk about how rewarding it must have been to be involved in this milestone, and how is the patient doing?
Oh, it was very rewarding. It was mostly done without me. I've only been here for about the last 50 of the transplants. I've actually just recently completed my own 500th kidney transplant, which is also a bit of a milestone. But the thing about milestones is they come and they go, and then you got to look at the next milestone, and so that's what I'm looking for right now.
Well, congratulations to you
Thank
personally and to your team. So how is the patient doing since the transplant?
He's doing fantastic. Actually, he was a living donor transplant. His donor came out of the woodwork. He is a bit of a pillar of the community. Someone came forward who said, I'd like to give him a kidney, and we were able to evaluate him and get him ready for transplant. They had their transplant just a few weeks ago and are already both on the road to recovery, both doing very well.
That's really interesting that you share that it was a living donor. I think there must be a misperception out there sometimes that a living donor versus someone who has to be deceased in order to donate. So how does someone go about navigating the process to find out if they potentially can donate?
That's a terrific question. Living donation is so important for kidney transplant. It's fairly safe. We turn down a lot more people than we accept for living donor kidney transplant. We want to make sure that we're not taking a kidney from someone who's going to need it in the future. We're able to evaluate these guys mostly just over the phone. We talk to them, find out a little bit about their medical history, get some labs, and if it looks good, we're able to bring them into the clinic, get them evaluated very quickly. We know that living donors last longer. We know that their outcomes are better, and we're able to get people transplanted much more quickly because they don't have to wait in line for a deceased donor kidney transplant, which in New England can take 4, 5, 6, 7 years. So it's a great advantage, and it actually is associated with not only better kidney survival, but better patient survival. Patients live longer if you're able to find a live donor for them.
Now, on the patient side, how does a patient know if they're qualified and if they're a candidate for transplant?
It's a tricky thing. End-stage renal disease happens in older people. It happens in people with a lot of medical comorbidities. I worry there are a lot of people out there who don't think that they're healthy enough for a kidney transplant, and I would advise them not to make that decision on their own. I'd like to meet them. I'd like to see. There are certainly people who it's just not safe to transplant a kidney in them, but I feel like everyone could be a candidate for a kidney transplant, and I want to meet them and see if there's a way forward that we could help them out.
What's the future for solid organ transplant here at Dartmouth-Hitchcock Medical Center?
The future is bright. We're well equipped. We have a small, thoughtful group. We have backing from the administration. We have a growing interest in the community. We have a growing interest from referring kidney doctors from all over New Hampshire, from Massachusetts, from Maine, from New York. We saw someone this morning from Pennsylvania. So I think that the word is getting out that we're up here, and so I'm just excited about the future here.
Well, congratulations to you and your team on your success.
Well, thank you very much.
I'm joined now by Dr. Michael Chobanian, Dartmouth-Hitchcock Solid Organ Transplant Medical Director. So tell me, what makes our program here at Dartmouth-Hitchcock Medical Center unique?
We're unique for many different reasons. It's amazing to me that Dartmouth-Hitchcock is a tertiary medical center, at times even beyond what I would call tertiary medical center, and it provides an opportunity, being out here in a rural area, to provide just first-class, top-notch care of all, to all patients, and they don't have to necessarily go to other places. We're sort of a beacon, I think, for northern New England to provide the quality of care that we have here, especially in transplantation.
And for that beacon of quality care, does it encompass just adults, or is it pediatrics as well?
Yes, no, we take care of all potential patients and potential recipients in that. We have an excellent working relationship with CHAD. That it's an outstanding ICU group of people. All of our children have the capabilities of being cared for by pediatric nephrologists. I myself am a pediatric nephrologist as well as an adult nephrologist. And so we all have the experience to be able to provide that option of getting a transplant here at Dartmouth-Hitchcock from roughly around 3 or 4 years of age, right on up beyond the 80s.
And what's your vision for the future here at Dartmouth-Hitchcock Medical Center for our transplantation program?
I'm very excited about transplantation right now. We have a full contingency of just really super high quality surgeons here with experience in a vast array of organ transplants, but that brings a lot of skill and a lot of technical ability to be able to do the most difficult of procedures. Our hopes are to expand again. We once had a very active pancreas program. We are planning to reopen that, expand our outreach throughout the tri-state area. We hope to bring people from all over New England to understand that the opportunities here at Dartmouth are somewhat unique. We have unique programs for treatments of various kidney conditions, as well as we feel that we have a lot of experience in taking care of diabetics who might also need a pancreas transplant.
So this is obviously a team effort here at Dartmouth-Hitchcock Medical Center. Anything you want to say to your team?
Well, our team has been here from the very beginning in 1992, and here we are in 2020 celebrating our 1,000th transplant. And we know as physicians that we could never have done it without their enthusiasm, their knowledge, their commitment, and their dedication to the patients. And that's really what makes us successful.
Well, congratulations on the success of this milestone. I look forward to sharing your next one.
You bet. Thanks so much.
Now that you've heard about our transplant program, let's talk about the process for organ donation. Joining me now is Posey Durning, Regional Director of Organ Donation from New England Donor Services. Posey, how does Dartmouth-Hitchcock Medical Center support the mission of New England Donor Services?
Dartmouth-Hitchcock supports our mission by referring all potential organ and tissue donors to our call center, our 800 number, 24 hours a day. And those patients are either patients who've suffered some type of traumatic brain injury or are without a heartbeat and can be potential tissue donors, corneas, bones, other soft tissues.
And what are the various roles of your staff who interact with our transplant program team?
We have 3 primary roles of people who work with the Dartmouth-Hitchcock staff on site. The first is a hospital relations coordinator. That's a person who provides a lot of the education to hospital staff members. They also meet regularly with administration in the hospital, providing them reports on organ donation outcomes and things of that nature. So that's a hospital relations. The next person is a family services coordinator. Whenever there's a potential organ donor, one of our family services coordinators goes on site to meet with the potential donor family and talk about organ and tissue donation. And the third is a clinical role. It's a donation coordinator. When we have an active organ donation event going on, the donation coordinator coordinates the entire clinical process, running lab tests, getting additional studies done, and then allocating organs, and in fact taking the patient to the operating room.
And what are the biggest opportunities to increase the amount of organs for transplantation in the future?
I think the future, really the biggest opportunity is with new modes of organ preservation and either repairing organs on a preservation machine or extending the amount of time that an organ can be preserved. So there are various clinical trials going on with liver pumps, lung pumps, and heart pumps in order to repair those organs if they are perhaps not suitable, but also extend the amount of time they can be preserved. So allowing further geographic distances for transplantation, things of that nature.
Thank you, Posey. For more information on our transplantation services, visit d-h.org/transplantation, or for services for organ donation, visit neds.org.